Intermittent Fasting to Fight Obesity, presented by Noel Dethridge. History of intermittent fasting goes all the way back to ancient Greece with Hippocrates. He used fasting as a way to heal the sick. Religious spiritual fasting has been part of history going back to the Jewish tribes of ancient Judea. This fasting was done during certain times of the year and began a long history of intermittent fasting traditions. Many cultures used fasting as a way of communicating with their gods, and healers used it for health enrichment and spiritual enlightenment. Intermittent fasting techniques have historically been used around the world in many religious ways. During Ramadan, when those in the Muslim faith practice fasting to cleanse the soul and the bodies of impurities, Buddhists and Hindus religions fast for health and purity. Lenten fasting in the Catholic faith is a way for Catholics to show abstinence. Through history, many prominent people viewed fasting as a way of purification and a way to increase health within one's body. Benjamin Franklin was one such prominent individual who once said, "The best of all medicine is resting and fasting." Studies that began in the 1950s showed that using intermittent fasting to help those obese individuals lose weight and become healthier. Intermittent fasting began to gain traction in the Bloom studies of the 1960s. In this study, Bloom and his colleagues concluded that a starvation diet, or intermittent fasting, was a healthy way for those morbidly obese to lose weight and reverse some of the negative health consequences of obesity. Their study advocated a maximum fasting time of 117 days with follow-up if needed. This study was also followed up by an in-depth study in 2015 by Trevolt, Norbert, and colleagues. So how does fasting work? Well, there are two types of fasting. There's alternate day fasting, which allows a period of 24 hours of not eating or drinking anything, and then 24 hours of feasting, where an individual can consume what they would like with the indication that they follow a healthy, balanced diet. So the fasting period is not dismissed by consumption size. There is also time-restricted fasting. This is when there is a designated time period of not consuming any food or drink, and a designated time of eating. This is the most popular fasting regimen. There are multiple time techniques, but the most used are 16:8, 14:10, and 5:2. These are set as the hours of fasting and the hours of eating. Most often, fasting hours allow clear liquid and water only. However, most say only water consumption is allowed during those fasting hours. Once you're able to consume food, you are expected to consume at least 25% less calories than the diet preceding the fasting. So if you ate 1,500 calories before fasting, then you should only consume 1,125 calories during fasting. Alternate day fasting is one of the first three studies I reviewed. The first study was a randomized controlled trial consisting of 32 total participants randomly assigned to either a control group or experimental group. All experimental group participants had to fast from food and beverage for 24 hours and then eat and drink for 24 hours while restricting their total calorie intake by 20 to 25%. This was measured by using the Mifflin-St. Jeor equation, which measures the resting metabolic rate. All of this while the control group was able to eat whatever they would like. The study length was 12 weeks, and it included participants had to have BMI between 20 and 29.9 kilograms per meter squared. Age had to be between 35 and 65 years. Pre- or postmenopausal women, lightly active for 3 months prior to the study, or weight stable for 3 months prior to the study. Non-diabetics, no history of cardiovascular disease, non-smoker, and not taking any weight loss, lipid, or glucose-lowering medications. Exclusion material included anyone that was above or below the BMI of 20 to 29.9 kilograms per meter squared, anyone aged younger than 35 or older than 65, women in menopause, those that were physically inactive, those that had diabetes, those with cardiovascular disease, those who were smokers, and or those who were taking weight loss, lipid, or glucose-lowering medications. The results were body weight decreased by 5.2 kilograms in the alternate day fasting group relative to the control group by week 12. Fat mass was reduced by 3.6 kilograms, and fat-free mass did not actually change versus the control. The second study was a cohort study with an embedded randomized control trial, including 90 healthy subjects. 30 of them were performing the alternate day fasting for at least 6 months, and the other 60 healthy subjects without a particular diet. The study length actively was set at 4 weeks and concluded after 4 years. There was no known inclusion criteria for this study. However, the exclusion criteria was history of metabolic disorders, history of cardiovascular disorder, any acute or chronic inflammatory disorder, known malignancy, those who consumed tobacco, alcohol, or abuse of recreational drugs within the last 5 years, those with dietary restrictions, those women and men on hormonal supplementation, women on hormone-based contraceptive agents, anyone with therapy of antidepressants within the last 6 months, regular therapies of acetylsalicylic acid, or current medications to regulate blood sugar, blood pressure, or lipids, and those women who are pregnant, breastfeeding, or aiming to become pregnant during the course of this trial. The results show that the alternate day fasting group had a total caloric reduction of 37.4% compared to the control group of 8.2%. The study also showed that there were no changes in the resting energy expenditure after 4 weeks on feast days. This shows that the individuals who are at a normal, healthy weight have a higher level of fat-free mass. This was measured by using the DEXA scans, which showed a fat reduction of 14.5% with a deviation of plus or minus 6.4%. The final study of alternate day fasting was a randomized controlled trial consisting of a 1:1:1 ratio of alternate day fasting group. The alternate day fasting group consisted of 34 participants. A caloric restricted group consisted of 35 participants, and the non-intervention group of 31 participants. Those selected for the study were asked not to make any changes to their physical activity in any way during the duration of the 1-year trial. This study length was the longest, and the length was set at 1 year. There were 2 inclusion criteria only. Adult subjects eligible to participate had to be between the ages of 18 and 65 years old and had to have a BMI between 25 and 39.9 kilograms per meter squared. The exclusion criteria was anyone with a history of cardiovascular, type 1 or type 2 diabetes, use of medications that could affect the study outcomes, unstable weight for 3 months prior to the beginning of the study, irregular menstrual cycle or perimenopause, pregnant or currently smoking, taking antidepressants or anti-anxiety medications, not able to keep a food diary or activity log for 7 consecutive days during screening, and or are pregnant or trying to become pregnant. The results of this study were that it showed 100 metabolically healthy obese adults selected in 2 weight loss phases, that weight loss after 1 year in the alternate day fasting group was not significantly different from that of the daily calorie restriction group, relative to the no intervention control group. According to this study results, neither group benefited greater than its counterparts. It is worth noting, however, that both groups did show a weight reduction over a period of 1 year, proving that limited intake of food, either via fasting or limiting calories, has a positive effect on humans' weight. Time-restricted fasting is the other 2 articles that were reviewed. The first study was a cohort study using a randomized design, assigning 116 overweight or obese participants to 2 study groups, time-restricted eating, and consistent mealtime groups, using the 16-8 intermittent fasting structure. The study was planned for 12 weeks. It included men and women aged 18 to 64 with a BMI calculated of 27 to 43. The exclusion criteria was none reported. The overall results were, of the 116 participants, the study showed significant decrease in weight in the TRE group, but no significant changes in the control group. In the in-person cohort, there was a significant within-group decrease in weight in the time-restricted eating group, but no significant changes in any of the other secondary outcomes within the between groups. The second study was a pilot cohort study to assess the adherence of time-restricted eating. There were 50 participants, all with obesity. The inclusion criteria was a BMI of 35 or above. The median age for this study was 50, and most 74% of the participants were female. There are no major exclusions noted in this study either. The results of the study showed that at weeks 6 and 12, 64% and 58% of participants continued to practice time-restricted eating on at least 5 days of the week. Using the last observed carried forward imputation, the mean standard deviation weight loss was 2.0 kilograms and 2.6 kilograms at 6 and 12 weeks. Among participants who provided follow-up data, those who adhered to the intervention for at least 5 days recorded greater weight loss than those with lower adherence. A total of 26% of the sample lost at least 5% of their body weight at 12 weeks. The intervention had no effect on blood pressure or lipid profile. So, benefits of intermittent fasting on weight loss. Intermittent fasting allows an individual's internal homeostasis to go from off balance to balanced. Fasting allows the body to rid the liver, kidneys, and blood from toxins that may be built up from food products, as well as too much metabolic toxins built up. Fasting allows the body to also decrease fat mass while eliminating excess weight. With multiple different fasting techniques, everyone could tailor one to create a new lifestyle as well as fit one into their current lifestyle. Making changes to eating habits is the primary basis for intermittent fasting. However, there are many other factors that can be included, such as physical activity and sleep-wake cycle changes, which are all involved in the metabolic markers in overweight and obesity. Intermittent fasting is a means of weight loss for those that abstain from consuming food to decrease calorie intake. Intermittent fasting is a significantly new weight loss technique and needs a little bit more research to show significant results clinically as well. However, intermittent fasting techniques are a promising technique in the weight loss program for obese individuals who are highly motivated to lose weight for health reasons. Intermittent fasting has shown promise to increase metabolically unhealthy obese individuals' metabolic health. With intermittent fasting, there are also behavior techniques that could be taught by a registered dietitian or obesity educator within a weight loss program. These programs typically have an agenda for weight loss, including meal and physical activity plans. Sessions are usually an hour to an hour and a half and require a review of a food diary that is meant to be kept while in the program. Dietitians are usually the coordinators of the program and attempt to utilize the most personal approach to each individual participant that creates a positive and inviting environment for success of the individual. Some things to think about when coming to benefits. Thinking and memory. Studies discovered that intermittent fasting boosts working memory in animals and verbal memory in adult humans. Intermittent fasting improves blood pressure and resting heart rates as well as other heart-related measurements. Young men who fasted for 16 hours showed fat loss while maintaining muscle mass. In mice who were fed on alternate days showed better endurance in running. In animal studies, intermittent fasting has prevented obesity, and in 6 brief studies, obese adult humans lost weight through intermittent fasting. In animals, intermittent fasting reduced tissue damage and surgery and improved results. So there are some limitations of intermittent fasting. It may not be for everyone since it can be a strict and more regimented type of lifestyle. which requires highly motivated individuals to practice it successfully. So far, researchers are finding that dropout rates of the studies are largely contributed to a lack of obtaining statistically sound evidence for intermittent fasting in a clinical setting. But the lack of commitment seems to be the heaviest weighted barrier to intermittent fasting. Lack of appropriate sample sizes is a major limitation for success of these intermittent fasting researches. Because subjects are not willing to commit to the length of the study or are not ready to lose weight, therefore, subjects have not reached the preparation or action phase where they are ready to make a change, if you're following the trans-theoretical model of change behavior theory. Additionally, research to evaluate the effectiveness in all population is important. However, with the lack of biological markers tested for evidence of internal metabolic changes for the individuals being treated with intermittent fasting techniques, this is very difficult. Intermittent fasting has potential to be the next big weight loss technique that proves to be clinically sound. However, there are many more research studies that need to be completed before proving this technique to be statistically sound evidence for clinical use. Lack of an education factor needs to be addressed before one can treat individuals with intermittent fasting. Knowing the pros and cons of which intermittent fasting technique will work best for which participant is of the utmost importance for success in intermittent fasting in the clinical setting. Along with weight loss, measuring metabolic changes are also extremely important when being clinically treated for obesity and obesity-related diseases. Along this journey, I have used intermittent fasting as a technique that can teach individuals how to have the power to eat and enjoy food while also living a lifestyle that promotes education of healthy living. Clinical approaches to weight loss have not made great strides in the obesity world. Intermittent fasting could be the change needed to motivate individuals to live healthy without pharmacological or surgical assistance. At the beginning of this fasting journey, I was feeling sluggish, never hungry, just eating because I knew I should and food looked good. I had no energy between my career, school, and a family, so I was determined to alleviate fatigue and enhance weight loss to increase my energy levels. I chose the time-restricted fasting method largely because I wanted to see how my body would react to the changes. I started with 14-hour fasts for 2 weeks, and I currently am completing 15 to 16-hour fasts for the past 4 weeks. I utilize an app for this specifically because it holds me responsible. It's a behavior that needs to be implemented, which is part of the lifestyle change. I also decreased my energy intake from 16 to 1700 calories per day to 1250 to 1400 calories per day. Now, I know when I was going through the studies, they stated 20 to 25% of your original calorie intake. However, for me, it was not that I needed a huge decrease in calories as much as it was that I needed to make changes to the number of times I ate. Because I was eating such small meals, small amounts of food all day long is why I was never feeling hungry. This made it difficult for my body to rid itself of the byproducts of food, which in turn ramps up the storage of the byproduct as fat in the system, and the body gets out of whack. I definitely promote intermittent fasting method research. I believe that it is a sustainable practice to change your lifestyle and has very promising metabolic effects on the human body. This can make large changes to the quality of life in those that struggle with overweight and obesity. However, it can also increase your quality of life in those that are normal weight individuals but may need a body reset to allow for balanced functioning again.